Good morning, everyone. My name is Gabrielle, and with me is Ellie. We will be presenting on parenting after polio. Here's a brief outline for today, including the methodology, outcomes, and recommendations of the project. Parenting after polio has been spearheaded by Nemo Hersey, a mother of two who has had polio. Seeing firsthand the gap in the Australian healthcare system for parents who have had polio, Nemo raised this issue with St. Vincent's Polio Services and Polio Australia. We have had the privilege of working alongside Nemo, Denise Curry, Steph Cantrell, and the many stakeholders we have had the opportunity to speak with, including mothers, health professionals, and advocacy organisations. Polio in the Australian context is changing. Australia experienced the poliovirus epidemic in the 1950s, with the last poliovirus transmission detected in the 1970s. To date, the healthcare system has adapted to address the needs from acute polio to the late effects of polio and post-polio syndrome. This is much needed as the Australian post-polio population ages. However, many countries remained polio endemic until recently. This map shows data from the World Health Organization representing the recorded cases of paralytic polio worldwide from the 1950s to the 2010s. Afghanistan and Pakistan remain polio endemic today, with WHO only declaring Nigeria free of wild poliovirus in September of 2020. There is a new generation of polio survivors, young polio survivors who are becoming parents. And with this new generation comes a need to adapt the Australian healthcare system as polio survivors come from across the world to live in Australia. The Parenting After Polio project is one step forward in addressing the gap between quality antenatal healthcare in Australia and the positive experience, enjoyment, and long-term health outcomes of mothers and mothers-to-be who have had polio.
The aim of our project was to provide a resource to all relevant stakeholders that will support positive pregnancy, birth, and baby care for women who have had polio. We had 4 objectives, with the first being to identify the relevant stakeholders and their needs. The second, to explore evidence around common issues, gaps, interventions, and supports. The third being to identify, sorry, something's happened. Sorry, I've just lost my presentation. Can everybody still hear me okay?
Yes. Yeah.
Sorry, to identify relevant recommendations, services, and contact details. And the fourth being to develop adaptable written resources for relevant healthcare service providers and parents. The project brief was to create a resource to support new parents who have a history of polio and are now living with a physical disability as a result. Considering the broad scope of the brief and all the stakeholders, including healthcare professionals, services, and mothers, it was important for us to conduct the project in a way that would support relevant and beneficial outcomes for all of the stakeholders. A participatory action research methodology was therefore adopted. This methodology promotes the active involvement of all stakeholders, and in particular, people who have historically been the subject of research. It seeks to generate understanding for a specific context and outcomes that are relevant and beneficial to the community of stakeholders. In this figure, you can see how the basic principles of the methodology were used through each phase of the project, which involved many interviews, gaining feedback from stakeholders, and lots of reflection on our part. The first objective of the project was to identify all of the stakeholders and their needs, and we were able to engage with representatives from each of the stakeholder groups through interviews, in some cases multiple interviews, with all but the NDIS and DHHS. To meet the second objective of the project, a literature review was conducted using terms such as polio, post-polio, and parenting. However, due to the limited literature that was returned, our search terms were expanded to include all research relating to parenting with a physical disability. And eventually 28 peer-reviewed articles, together with 17 interviews with mothers and healthcare professionals, were reviewed. Overall, it was found that there was a very limited high-quality published evidence to guide practice in this area by healthcare professionals. However, interviews with the parents and the evidence that was returned generated 23 themes, some of which you can see here in this Excel sheet. And these themes supported us to understand what content the resources should contain to best meet the project's aims to support positive experiences for mothers. Common themes reported by both mothers and healthcare professionals related to tasks, equipment, and adaptive strategies for baby care tasks, such as bathing, dressing, and feeding. And both mothers and healthcare professionals commonly raised as a theme fears relating to child protective services and the need for advocacy. Parents discussed inaccessibility of information as an issue. And interestingly, there was no literature related to the NDIS and parenting after polio or with a physical disability. And our findings suggest there is a lack of clarity in both healthcare professionals and mothers on whether NDIS plans can support mothers who have had polio in pregnancy and baby care, how mothers can access the NDIS, and whose role it is to support mothers to do this.
Many themes arose, including those specific to occupational therapy interventions and equipment needs. However, the methodology behind the project, regular engagement with stakeholders and reflection, highlighted these 6 themes to achieve the project's aim, to provide a resource to all stakeholders that will support positive pregnancy, birth, and baby care for mothers who have had polio and live in Melbourne. These themes informed the content of the resource. As mentioned, there is a significant need to re-understand polio today at both a community and organisational level. Key to providing quality care is collaboration between every individual, organisation and system involved, including the earlier mentioned list of stakeholders identified. Early referral is crucial. There are 9 months to prepare, and within those 9 months, changes occur regarding centre of gravity, mobility, and so on. The Women with Individual Needs Clinic, or WIN Clinic, is an invaluable service based at the Royal Women's Hospital, which provides individualised pregnancy care and one-on-one childbirth and parenting information. The clinic has a midwife and social worker dedicated to providing support and referring parents to appropriate community services. Additionally, while we may be biased as occupational therapy students, some have considered occupational therapy to be underutilised in this space. OTs are uniquely trained to provide supports, training, equipment, and adaptations for the practical tasks of living. This includes pregnancy, birth, and baby care tasks. They may also be well suited to enhancing NDIS applications. Gaps in services are of course evident. In occupational therapy alone, there is a gap in the practice and research of this particular area of practice related to parents with disability and parents who have had polio. There are undoubtedly gaps in many services like this. Advocacy and raising awareness is a start. Health professionals, parents, community members, organisations, support systems, all these need to be aware of the gaps in services, the rights of parents with a disability, and the responsibilities they hold in the provision of care. Institutional discrimination is an issue highlighted in literature and by the advocacy services and mothers we have interviewed. It is of note that this issue is underreported by health professionals, which indicates the ongoing challenge of tackling discrimination in this and every setting. Parents and health professionals alike need to be supported and aware of the rights of parents, people with disability, and parents with disability, regardless of race, gender, and age. It is important we place particular attention on the NDIS. There is a lack of understanding for how the NDIS can be accessed by parents who have had polio, their eligibility for funding, and whose role it is to support these parents to gain access. Again, this takes us to early referral and the need to support parents in whatever ways possible to apply for funding and update their NDIS plans, keeping in mind the chances of rejected applications, misunderstandings, and the time taken to process applications and funding plans. As you can see, each of these themes is intricately linked, and one cannot be addressed without addressing the other in kind. We have developed two booklets, one for health professionals and one for parents, someone who is planning to be a parent, or someone in this age bracket who has had polio. The booklets begin by outlining polio and its relevance in the current Australian healthcare system. The focus for health professionals is in raising awareness of the needs and wants of parents who have had polio. For parents, an emphasis is placed on the need to understand the current healthcare system and the vital role of self-advocacy as this system continues to adapt. Also provided are the common issues and key recommendations that have been identified through research and discussion with parents and health professionals. The booklet goes on to highlight the continual importance of collaboration, particularly as the healthcare system goes through this period of change. Effective communication, planning, preparation, and resource sharing are instrumental in the provision of quality healthcare. A description of the roles and responsibilities of each key stakeholder involved in pregnancy, birth, and baby care is outlined. These include relevant health professionals, the NDIS, advocacy services, and polio-specific supports. Finally, key considerations are outlined in further detail. These include institutional discrimination and the rights of parents and parents with a disability, the complexities of the NDIS, the Women with Individual Needs Clinic, considerations regarding the importance of mindful language in building rapport and giving insight into the understanding of parents' unique wants, needs, and history, and more. Also included are some key contacts that support and provide service to both health professionals and parents. Together, these resources meet the aim of this project by fostering positive and enjoyable pregnancy, birth, and parenting experiences, teamwork and communication between parents and healthcare professionals to meet the needs and wants of parents, and further growth within the healthcare system to provide service and support to the highest standard.
The gaps identified through this project actually go well beyond the scope of this project and what can be accomplished within 10 weeks. And interviews and discussions with St Vincent's Polio Services, Polio Australia, parents and health professionals have identified varying views, needs and wants. Through the resources we have created, we hope to emphasise the importance of collaboration, early referral and assessment and planning. We've identified the underlying commonalities between the needs and wants of the voices we've heard. However, this resource is just one part of raising awareness amongst health professionals and the community of the gap in our healthcare system. The effort to close this gap does not stop here, and this resource is just a starting point from which to further grow and develop this project. A limitation of the resource is that while we have gathered feedback from parents throughout each step of the resource's design, the resource's primary creators, us, are not mothers-to-be who have had polio. A further limitation of the resource is that they've been created in English, which in the case of the booklet for the parents is not the first language of most of the mothers or mothers-to-be who will be reading the resource. And we're therefore strongly recommending that this resource be translated into relevant languages and that other media, such as video or social media content, be considered for the parenting resource, as these may be more accessible and relevant to the age group of that population. Dissemination of the resources is another key factor that falls beyond our scope. And while it is important for each of the identified stakeholders to have access to the resource content, we are strongly recommending that the resource be disseminated to the Women in Need Clinic, through St Vincent's Polio Services and the other polio organisations in Victoria, and through advocacy services, and that further research into dissemination is required. This project has highlighted the lack of research, resources and services available to parents, both mothers and fathers, with polio and with physical disabilities more generally, and we are recommending that further research and engagement by all stakeholders occur.